Rayudu ji.
Okay, now.
Yeah. It's okay. Everything okay. We can see you. We can hear you.
Okay.
Yeah.
Perfect one.
Yeah, perfect, sir. No problem.
Very good background. Very good.
Sorry,
Nicely dressed.
Yeah. You take a long breath. No problem. We have time.
Looking very smart, sir.
Yeah.
Okay, thank you.
Sandy Rogers, please invite our speaker. Welcome our speaker, Sandy Rogers, please.
Rồi just cái vào cái nhỉ.
Ma'am Sandy Roger, please come invite our speaker.
Hello, Rava Sandy Rogers. Hello.
She is not available.
Okay. Then Rayudu ji, you can start your talk. No problem.
Okay.
Yeah. Please.
All the respected participants, today's topic for interaction with you is on subject of effectiveness of autourine on cancer cure. The subject is on cancer matter. Therapy, how it works on treatment of cancer. You see, the word has two meanings. Cancer. One is, it is the name of the cell and it is the name of the disease. The disease, it is called disease because it is because of uncontrolled growth of cells. Uncontrolled growth of cells and fast communication in the body from one part to other part. So cancer means it consists of some trillions of cells. Not hundreds, millions, and thousands, trillions, trillions of cells. So it is a queen. Cancer is a queen of terror killer. Terror killer, a silent killer, a disease of silent killer. You see, among the various diseases that are available, human being facing, and cancer is the kingpin of all diseases. Kingpin of all the diseases. Nearly, it is estimated annually at about 20-25 lakhs of people are suffered from cancer. Many people are dying, registering for admission. This is the position of the cancer. If this cancer is not controlled and checked, the mankind, the humanity may disappear from this globe after a few centuries. Here, the main topic is whether urine therapy is effective for the treatment of cancer. The efficacy of the urine therapy has been clinically tested and proved in many cases, both in India and outside also. Earlier, there were research studies or serious studies on cancer, particularly with reference to urine. But now, today, scientists, doctors, and researchers have been undertaken a number of studies and research works and clinical observations to investigate into the potential of urine for the treatment of cancer. These research works studies conducted because to verify whether urine therapy is true or not, whether it will cure or not. Another thing, the reason for research is that increasing number of cancer patients and treatment is necessary now. That's why the research is going on, and in many cases, hundreds of cases are there where urine therapy has successfully treated cancer patients. You see, among all these hundreds and nearly 5,000 diseases are there that a human being is facing according to yogic texts. All these diseases put together have been broadly classified into 5-6 categories: common disease, acute diseases, chronic diseases, and degenerative diseases, and opportunistic diseases, communicable and non-communicable disease. Among all these group, cancer will come under the category of degenerative disease. Degenerate means body is generated by God. And within this generation of body, there are number of organs, tissues, and the cells in the body. If the cells of the body are damaged, it is called degenerated body. It means whatever the parts or cells or tissues or organ of the body dead, injured or missed, that you cannot replace, you cannot repair, you cannot reconstruct. That type of disease is called degenerative disease. That's why once a person gets cancer now, the result ultimately is only death, and there is no 100% guaranteed or sure cure treatment for that. It is a degenerated disease. Similarly, like HIV and AIDS, we cannot repair it because trillions of cells have been damaged in the body. Immunity system has been suffered. That's why we get that disease. That is the cancer nature. Then what are the modalities for the treatment of cancer by urine therapy? You see, urine therapy and cancer in relation to that. You see, once a disease is affected, there is no treatment, the person has to die. But what is the remedy for the cancer? Means we have to take measures, preventions, precautions, refilling of immunity system, and you must be away from opportunistic infection. It means the first stage, we can divide into 4 stages of treatment of cancer or modalities of treatment of cancer by urine therapy. So first is the before affection. Before affecting the cancer means precautionary methods. Precaution and prevention. What therapy is there? Urine therapy, allopathy therapy, or number of therapies are there. No therapy will work. Prevention, therapy. Precaution is a therapy. Refilling immunity system is a therapy. And be away from opportunistic diseases. From opportunistic disease only, we get cancer, cell damages, and injury. So before affection, what steps you have to take means these precautions, that is preventive measures. Preventive means prevention is better than cure. So an ounce of prevention is better than a pound of cure. That's the proverb. So this prevention gives the ability not to be affected by the disease. So what is the prevention? Once affected, there is no therapy. So what is the therapy main, or the doctor, the therapist, what's give advice to the patient? Means prevention measures, precaution measures, rebuilding the immunity system. The defect or immunity deficiency syndrome is the cause for the cancer. For that purpose, refilling the or development of the immunity system. So that gives the ability not to be affected by the disease. So that is the main principle, first principle before affection of the cancer. And the second step, second modality of the urine therapy means when symptoms are pronounced, symptoms of the disease are pronounced, or when symptoms are experienced by the patient. So when the symptoms are experienced by the patient, we have to take the steps. Immediately, we must start urine drinking. So what is this before affection? That stage is the second stage. First stage is the prevention and precaution. And the second stage is before, or it is maybe a first phase, or it may be earlier to disease. Just earlier to the affection of the disease. So that is called symptoms level. So as soon as the symptoms are pronounced, the patient must immediately jump into and start urine taking so that they can further development of the disease can be avoided. So here the patient must know what are the symptoms of the disease. Symptoms only must know, only the patient must know. So what are the symptoms? The patient know so that we can take the precautions. So the first method is that prevention. The second method is immunity improvement, immunity system refilling capacity, and detoxification of the body. Poisonous material, unwanted material, waste material, all should be removed from the body. It means internal cleanliness of the body is essential. And then we go for regeneration, regeneration, refilling, retransformation, and repairing the immunity system, or that immune system consists of cells. Damage of these cells is the result of cancer. And here, urine therapy helps in a way that is called antidote. Urine therapy will prevent antibodies element in the body. It means it has the quality and the property of antivirus, antifungal, and anti-parasites, anti-infection. So it is against even virus also. So virus is the main reason for the cancer, wherein urine works as anti-infection and anti-virus. So that is precautionary level in Mr. Cup. And the next is, you see, urine acts as a natural vaccination. And the general vaccinations are medical, synthetic chemicals. That even vaccinations and immunizations are also dangerous for the body in the long run. Because a child will take 15-20 type of vaccinations, but the time being is okay, it will have an adverse impact, side effects in the body after some time. It is also proved. So this is a natural vaccination because vaccination requires additional doses of the proteins and the nutrients. All these are found already in urine. So if you take every day the urine, so that deficiency will be filled. That is called nutrition. Nutritional values, that will be the multivitamin supplement to the body. So urine therapy is a panacea. Panacea means a remedial measure for treatment of cancer. So now at the symptom level, when a person or a patient experiences the symptoms, or the symptoms are pronounced, immediately you must know what are the symptoms of the cancer. Here, education is important. It is not getting cancer after getting cancer, taking treatment. When the symptoms are appearing, you immediately start taking urine. Symptoms you must observe. Whether those symptoms earlier you have or not. So, what are the symptoms you must know? Once cancer is affected means no treatment. Urinopathy therapist or allopathy therapist, Ayurveda therapist, no therapist will be useful. No therapy will work. Death only will result. So, patient must know, we also all the people must know what are the symptoms of the. If you know the symptoms, immediately you can take remedial measures. In first stage, in the beginning stage itself, or just before the first stage. So these symptoms, physical body or physical body weight will reduce. Body weight will be lessened. That with the immediate signal or symptoms to take precautions. And first choice is the urine, fever, and then tensions, and then fever, change in skin, means irritations, rash, eruption, skin eruptions, and at the same time, colorful spots or marks on the skin. If these symptoms are found, immediately must take precautions. Even doctors also cannot do this stage we, the patient, must take this responsibility. Even the precaution, knowing the symptoms itself is also a therapy. Prevention is also a therapy. Knowing the symptoms is also a therapy. And another symptom is that there is a change in the habits of intestines and the bowel functioning. And there is a change in regular functions of the urine bladder and unusual bleeding. Please remember, unusual bleeding. And similarly, growths, lumps, nodes, swelling inside the body and any part of the body. And then cough, diarrhea. And this unusual bleeding may be from or through stools or through mouth. And difficulty in swallowing food, indigestion, and back pain, pelvic pain, and bloating in the stomach. So these are all the various symptoms. A few I am giving, these are the common symptoms. As soon as one experiences these symptoms, or symptoms are pronounced, you immediately start treatment. Those who are taking regularly urine therapy, people do not get even all these symptoms. And those who are not taking, but immediately must open the eyes and then start taking urine and go for testing at what stages. So knowing symptoms is one therapy at one stage. When once you know the symptoms, the next question before you is what are the causes for the symptoms of the cancer? Why these symptoms are? You must immediately identify the causes. You are the patient, you are the doctor, you are the drug. Only we go at last stage to the doctor, you cannot do anything. Only may prolong life for some time. Maximum lifetime is only 8-9 years without any advanced treatment. So you must ascertain what are the causes for these symptoms. So the first symptom is deficit or diet deficiency in natural salt. Diet deficiency in natural salt. Natural salt means salt obtained from seawater. And in Himalayas, you can get these deficits are the cause, not the cause for the symptoms of the cancer. And another, those who have been for a long time eating mutton, meat with heavy spice, salt, oil, and masalas. And those who have been taking vegetarian food of a long time, he converts into the non-vegetarian. These three are the dangerous causes for the cancer. So doctor or everybody, no one can do anything for any therapist for all these stages. It is responsible of the patient only. Prevention, precaution, and after knowing what are the defects of the body and causes, refilling immunity system. And another, tobacco, smoking, and then some alcohol, and then hookah, chewing tobacco. These are all the various dangerous causes for the disease. And immune system, immunity deficiency syndrome. If our immunity system is not strong and weak, cells in the immunity system are damaged, average cell counting has fallen down. That will be the case of immunity deficiency syndrome. So to fill up the immunity deficiency syndrome, that urine therapy works better in the immune cell itself. And metabolism malfunction, metabolism dysfunction. That patient must know this. Either metabolism working in a proper way or if it is a dysfunction and a malfunction, this is also a case. And at the same time, another cause you must ascertain is that is called, eating fast foods. dried foods, fried foods, tinned foods, bottled foods, packed foods, air-packed foods, fats, junk foods, and non-food items. If a person is taking all these type of foods now, generally a person has to face a number of incurable and innumerable diseases. Because these are not the food items, they are non-food items. Non-food items will give the body impure. If the internal cleanliness is not in the body, cancer will affect. Cancer will come definitely and affect the person. And growth of lumps, swelling, nose, and growths. These are the symptoms inside. Sometimes some people may not find the symptoms, may not feel these symptoms. Growth of nose and any growth inside, bulky side, swellings. So sometimes symptoms appear, sometimes symptoms may not appear. It is depending upon the person's constitution of the body. And in addition to that, a woman who does not have the children, they will get cancer. And mother who is denying breast milk to the baby, they will get cancer. An unmarried woman who suppresses her sexual desires for a long period of time will get cancer. Lack of internal cleanliness. We need detoxification. That's why if they take urine every day, automatically every day the body will be clean. Unwanted, unnecessary waste material, poisonous gases will go out of the body. That detoxification property of urine helps you to clean the body and keep internally clean. And long suppression of the diseases. Long period, we are suppressing the diseases, we are not getting cured. Our symptoms are suppressed, our symptoms are masked. We're just taking a temporary remedial measures, but we want to totally eradicate the diseases. It is called suppression of disease or masking of symptoms of disease for a long period of time. That affect the disease, that will lead to cancer disease. And at the same time, opportunistic infections. We must be away from opportunistic infection. What are opportunistic infections? These infections will come from germs. What are the germs? Bacteria, virus, fungal, and parasites. These germs are there everywhere, in water, food, air, inside the body, outside the body. So these opportunistic infections we do not know unless it is totally affected and symptoms are exposed. So be away from these opportunistic diseases. They are called opportunistic diseases. These opportunistic virus will destroy the cells and attack the immunity system. They enter into the cells of immunity system. These viruses will merge into the cells. When once the cells of the immune system are damaged, we cannot regenerate. Because some parts of the body, within the body, once damaged, if there is disease, you can cure. But if they are damaged, if they are missed, or it is injured by various reasons, so they cannot be repaired, regenerated, and reformed because they are God-given parts. Say, for example, cell we cannot replace. Tissue, we cannot replace. We cannot regenerate. The body cannot regenerate it. Or the organ is damaged. Say, for example, kidney, or the liver, or the heart. We cannot replace. They are God-given gifts. That's why cancer is a degenerative disease. that you cannot regenerate again. Body cannot produce, repair by itself whatever the cell is damaged, or tissue is damaged, organ is damaged. Or even some glands also. If any glands of the body are damaged, you cannot replace, you cannot treat. They are God given. They are generated, God generated. That generated has become degenerated. That you cannot regenerate. Body collapse. When one's immune system is damaged, malfunctioning, and dysfunctioning, and there is no treatment. This is the dangerous situation of the cancer. So one must be careful about this bacteria, virus, fungus, and the parasites. These attack directly the immunity system. They enter into the immunity system. They damage the cells. They merge. They mix with the cells. Actually, the cells, they are called T cells or CD4 cells. They are the helpers. They are the protectors of immune system in the body. If these protective mechanism has gone, body is waste. That cancer will affect. So that is called OIS, opportunistic disease. These opportunistic diseases will come because of these reasons. Remember, germs. They include virus, bacteria, and then fungus, and parasites. They are very microorganisms that you cannot see. They are within the body, outside the body, surrounding our body, in water, air, and food. And they infect the body. They infect cell system. They infect the immunity system. And body, first defensive mechanism is lost. If it is lost, the immune system, or you can say the bacteria virus, will dominate the body. The immune system cannot fight against this virus because cells are damaged. T cells are damaged. Only T cells and the cells CD4 are only the protective mechanism for the body. If they are not there, who are going to fight against the virus? The cells and T cells only will fight against the virus and the bacteria. So if the cells are not there, this is going to protect our body. The cancer will dominate. The bacteria, the virus will dominate our body. The body will become weak. The disease will affect. So everyone must be clean and neat, hygiene in every respect if we want to be away from cancer disease. And second is HIV, human immunodeficiency virus, human immunovirus. It is a virus. Because of immunity deficit, the virus dominates. That immunity has been damaged by virus. Virus will dominate now the body. So human immunodeficiency virus, HIV is called. So this opportunistic infections leads to HIV. This HIV is not controlled, gone out of checking, not treated, it leads to AIDS. The AIDS definition, complications will come out of the AIDS. Among them, one is cancer, and another is pneumonia, and the same cardiovascular diseases, TB, neurological disorders will come from this AIDS. So, opportunistic disease that leads to HIV. When HIV is in third stage, it will go to AIDS. That will be called AIDS is in third stage. AIDS is not in third stage. HIV is in third stage. Third stage of HIV is the result of AIDS. So, virus, first, second, HIV, if it's not controlled, but even at the third stage, that stage, third stage of HIV is called AIDS. So the AIDS definition complications of cancer, one of them is cancer. Others, just now I told you, pneumonia, TB, cardio, kidneys. They completely damage the part of the body. The main source is the immunity system. These are the three complicated structures. For all the causes for the cancer, these three are main. Infections, HIV, and AIDS. So these are all the three stages. First, the first therapy is prevention, precaution, and at the same time, filling or refilling immunity system so that we can solve the problem of immunity deficiency syndrome. And last, be away from opportunistic infections. And after that, after knowing the symptoms, next come to causes. After knowing the causes, you must know your body conditions. Doctor is the last stage. So before going to doctor, your therapeutic systems include all these things. You must know your causes for symptoms first. And what are the causes for this? Then we come to the question of what are the modalities, or you can say immunopathic treatment for cancer. This is very important aspect in this subject, the core of this topic today. So what is the role of urine therapy? Urine therapy treat cancer? There are hundreds of cases, particularly in Western countries, where cancer has been treated by urine therapy. In India also, very few studies, researches were there. Earlier, much importance has not been given to the studies, research on cancer. Recently, only people are taking up importance because to investigate into the potential of the urine, whether it will treat the degenerative diseases like cancer. And at the same time, scientists want to prove or they want to verify whether the Davartantra or urine therapy will be true, is true or not. Is it only a fake remedy? Is it only a folk remedy? Is it only a magic remedy? Or urine is only sympathetic medicine? Now that concept has today a lot of research work is going on, and number of cases where clinically have been proved that urine therapy is ineffective. The efficacy of the urine therapy has been proved. So the first choice in respect of cancer treatment, first choice is urine. And the last choice is urine. Because there are many patients, cancer patients, who are coming for treatment in the last stages. I received so many telephone calls. Or you must start with first choice. Because urine is urine has an intrinsic medicine. It has, or it is a incredible value, invaluable medicine. It is a ancient household domestic practice and medicine. Self-healing capacity it has. The body can heal itself. Body has capacity to heal itself. Body manufacture hundreds of substances, chemical and compounds. And these compounds have the capacity of self-healing. And these compounds are wasting, going out of the body by excretion, by passing urine. This secret scientifically and technically you must understand. So body is a multi-million-dollar pharmaceutical manufacturing company. How many types of medical values, medicines are produced by body, even science does not know. There are many substances in the body that are not yet discovered, not yet isolated and extracted from the urine, and medicines are made because less important has been given to the urine research and studies for several of long period of time. For so many other incurable and innumerable diseases that the next generation people are going to get. For that also, medicine is there, deposited in urine. But those substances secretly deposited in urine must be isolated, must be extracted. And those substances or hormones or compounds are useful for treatment of so many new diseases that are going to come. And presently, the cancer and AIDS and HIV. So that is the secret of that. First charge is that. Even Dhamma Tantra, Lord Shiva said that the medicine for the treatment of so many incurable diseases of Kali Yuga is deposited in the body itself. Please carefully understand and underline it. Shivam itself said, medicine for the treatment of degenerative, communicable diseases and artificial infections. The medicine is already deposited in the body of everybody according to the requirement of his own body conditions. Remember, special medicine for each body. No two bodies are similar in the nature. Every body is different. Every body is required to separate medicine. So urine is that product that is a personal drug. That is customized drug. It means it is made personally for us. For each individual, separate medicine. The composition of urine analysis, the result, the readings are quite different from one person to another person. So one universal medicine will never work to all people. Say painkiller is there, antibiotics tablets are they're universal. Anybody can use, but it works 50%, 50% it will use side effect because it is not made particularly to the requirement of a particular individual. It is a general universal medicine throughout the world. That composition of, say for example, dolo painkillers you can use. But in case of urine, it is specifically made for each individual. Tailor-made product. Tailor-made. See, Tailor prepared it just for us, particularly for each person, taking his own measurements separately. Like that, taking and knowing the characteristic features of each body, the medicine will be produced in the body. That's why you are the drug, you are the patient, and you are the doctor. These characters help the treatment of or curing for the cancer. And the second method is, you see, urine is one. It has the capacity, or it can be used for multifarious diseases. Many dimensional problems we can see, but medicine is only one. But there are several methods of taking it. Nearly 16, 17 methods of taking urine, but urine is only one. Say, for example, oral, taking, gargling, washing, bathing, bandage, massaging, and soaking. There are so many methods, but medicine is only one. Depending upon the nature of the disease, body condition, 1, 2, or 3 or 4 methods you can use for it. Any disease. And another thing, even if you see, for example, allopathic medicine is same, but you can take in the form of a pills, tablet, oral tablets, liquids, syrups, ointment, injection. Like that only, even in urine therapy, medicine is one, but there are several methods for treatment, for taking it. Here you see for the treatment of cancer, another angle, another modality that is called drinking of the first urine. The basic principle. You see, this is, you remember, is not only for cancer treatment. Every drinker, whether he has the disease or not, and anybody who is taking for prevention, or anybody who is taking for improvement of immunity system, every drinker, he has to take first urine. Not specifically for the cancer, but for cancer patient also must take the first. What is the first urine? When you get up from the bed, 4 o'clock, 5 o'clock, and 6 o'clock. That at that time, what you pass urine is called the first urine. But remember, before sunrise. Why? Because after sunrise, you see, there is one gland in our body, pineal gland. The pineal gland produces a hormone, a healthy hormone that is called melatonin. That will be produced only during night time. As soon as sun rays falls on our body, the pineal gland stops production of melatonin hormone. This hormone is contained in the urine. This has been isolated and extracted and applied in many cases for treatment of cancer. Melatonin, but you must take before sunrise. That is the first year. So at any time, even earlier, 6 o'clock, 5 o'clock, and 4 o'clock, first thing. So this applies not only to the cancer patient, to other triggers also, whether he has a disease or not, whether he is taking or prevention or improvement of immunity system to solve the problem of immunity deficiency syndrome. And another step, another modality for taking urine is mid-urine. Mid-urine, not beginning stream and the last stream. Middle, it means a few drops. At the time of passing urine, a few drops must be left over. You should not take it. Why? Because these drops, first stream of the urine, will clean urine tract or cleaning purpose. So there may be some dirty or dust and mud on the urine tract. That will be cleaned out. If that is taken, there is no use for body. Again, it has to process and review process and the cycle. Body is of no use. So that should be left, not taken. Similarly, last stream of urine, a few drops of stream of the urine, last stream of urine, you should not take. Because it is believed that the last stream of the urine consists of dust, uncleaned stones, and other material. Even if you take it, there is nothing wrong, first and middle, last, but no use to the body. Again, it is to be reprocessed and sent out. So when you are taking urine, it's not to use the body. It's going to generate altered product, new product, improved product for solving the disease. Taking the waste again of no use. It doesn't mean that is a waste, but no use to body. First and last. It's even along with so many yogic tests, meditation books, we find these points. Agora Babas and some yogis also this point they referred in their yogic texts. Even Lord Shiva also says in the Amartantra, on the mid-urine, he compares to a snake. Snake has poison not only in the mouth, but also in the tail. Lord Shiva compares with this snake and said that take one in mid-urine. It is not scientific findings or our own sayings. It is there in the Amartantra. Lord Shiva compares with the snake. Snake has poison in the mouth and the tail. So on similar lines, urine also first and the last should not take. Middle you take. So particularly for cancer patients, you must take these precautions. Generally, people will be taking urine at their own time. Many people do not know the first urine or mid-urine importance. They ignore it. But cancer patient must remember it. Our therapist must suggest to the patient, in addition to the rest of takings, so did I take anytime, no problem. But should not miss of taking the first and middle stream of urine. Because treatment for cancer is quite different. Say, sometimes for cancer treatment, you must take 24 hours urine. That is only food and water. Urine fasting. Fasting with urine. That is also the total body must change. That's why you must take 24 hours urine, depending on the cancer stage and body conditions. That usefulness, importance there for you, the total body must be purified. Detoxification is to be done. Immunity system should be refilled. All viruses should be killed. Because urine contains antiviral, antibacterial. And urine contains chemicals that will kill bacteria, virus, fungus, and parasites. That's why that urine helps in these ways. One is rebuilding immunity system, detoxification of the body, and act as an antidote, antibodies. Antibodies should not be there in the body. Like that, you can take urine, particularly for cancer patient who takes as much quantity as urine is the best for treatment. And we take 2-3 hour methods you can follow. One is drinking, say the main problem with the cancer patient is bad and the foul smell out of the mouth. You observe a cancer patient from his mouth a bad smell, a foul smell is come. So we can go for gargling with the urine. Here urine works. Because that foul and bad smell is a side effect of the cancer. And for that there is no medicine. But urine works. With the urine, gargling, if you don't know, that bad smell will go. Similarly, you observe the cancer patient produces from his body bad smell and foul smell. Bad and foul smell will come from the body. Even visitor, relatives, and caretakers know they cannot sit with the cancer patient outside because bad smell is coming. So for that purpose, treatment is the urine. He can wash the body with urine, take bath with urine, and for that there are no medicines. You see how terrible the disease is there. We have to tolerate, the patient has to tolerate, and the family members have to tolerate. Here, urine therapy will come into rescue to solve the problem of smell, side effect of the cancer. So we can use the internal purpose and external purpose. Doesn't mean only we have to take the oral drinking. 2 methods, 3 methods you can follow depending upon the body conditions. So that is called, remember please, bad smell. Side effects are more dangerous, more painful, trouble for the patient to face. That cannot be treated. There is a major side effect also. Urine will come into this to solve this problem. So internally you can take, externally you can apply no problem. And the same enema and the constipation. Constipation is best. Constipation is also one of the side effect of the cancer. Moraji Desai mainly suffered with constipation. He solved with the urine. His brother suffered from TB. He solved, Moraji Desai solved the TB of his brother with urine therapy. Such wonderful case stories, recovery stories are there, but they're sporadic, scattered in the houses only. The case studies are not coming out. Further, somebody must conduct a research and a survey on this. The costly matter, no one is coming forward to do such a vast research work. Who has taken the urine, what diseases, and what is the result? All these success stories, recovery stories are in secret, underground, hidden in the houses of the people, in the households of the people. Another thing is elixir. Urine is elixir, the nectar. Lord Shiva in the Amrit Tantra says, Shivambupane Amrute. Shivambupane, water, urine. To drink, that is a nectar, that is elixir. So it is a statement of Lord Shiva, not mine or a doctor or any therapist. Shivambupane Amrute. So it is Amrut, new energy, additional energy for the body. Sarvavayarini Vinashayet, all diseases, all side effects, Vinashayet, dissolve, will be dissolved. Deha dosha Vinashayet, all doshas, defects of the body, side effects of the body will be removed. So, elixir, nectar means this is a liquid or energy that the gods will drink. But for human beings, the nectar, the elixir is urine. Why that is called as nectar? Actually, it is not a nectar. Urine is not a nectar. But we are equating for human being, urine is a nectar. But it is not a real nectar. What exactly meaning of the elixir nectar with reference to urine therapy? It means it cures, urine cures, nectar cures all diseases. All people, it cures all. All means no caste, no religion, no sex, no country, no discrimination at all. However, human being. It's not subject of particular religion or the caste. It is the cosmos God created. This is the urine system created by God for every human being. No boundaries, no caste, no barriers, no religion. Every human being to be worth. And another secret of the elixir, nectar means it is a holistic medicine. It means it treats not only the physical body, but body, mind, and spirit. Please remember, physically you are not, your sound means it doesn't mean that you do not have a disease. WHO said, health does not mean the absence of disease or inhibition of any physical inability. Diseases are inside mind and spiritual matters, and spirit and this mind are within the body only. They have also equally influence on the disease. So physical development, mental development, spiritual development, emotional development, environmental development, ethical aspects, social aspects, all these are the factors which collectively influence directly or indirectly on the body and health of the person. That is called nectar, elixir. So urine is a nectar, elixir that will easily cure cancer also, HIV also, AIDS also. If you want in detail of the study of the HIV and the AIDS and some other day, you can fully devote on subject. What is the AIDS, what is HIV, and what is it, urinopathic treatment for all disease. But these are technical and scientific, like cancer. So some other day we'll discuss on that subject also, HIV and AIDS. So this is the elixir. And there are many people also ask, it is a frequently asked question. I do this when you telephone calls. Urine is a waste product, you are passing out, it is excretion. How this urine again reintroduce the body? What will happen? Say a diabetic patient is asked, urine contains sugar. I am a diabetic patient. So sugar is added. Sugar increases. This is common doubt of the people. So it is not the case. So though urine sugar contains, if it is reintroduced to the body, that goes into the body and passes into intricate several stages of its journey. Cycling and recycling. Medically, in medical sense, it is called transmulation takes place. Once urine we take, what happened to the body, or what happened to the urine that has gone inside means transmulation. It passes several stages in the body. So what is transmulation? Means urine, waste urine, when you take it, it is a new product is produced, an altered product, an improved product, medicated product will be produced. That you do not know. That is called transmulation. Means secret that you do not know what is happening to the urine. Because much research has not been done on this process of this method. The digestive system does not know what is the food, what is the urine, what is the waste. It is a dustbin. So what the digestive system will do? Grading, classification, and the removal of waste products. It does not know whether the urine, food, chapati, veg, non-veg, or fruits. The mixture of the juice, from that mixture, waste is separated. That is the function of the body. In the stomach, at intestinal level and liver level. Their waste at the lower level only will be removed and set out of the body. urine is at higher level, at kidney level, nephrons level. At that level, there will be no waste or poisonous product or poisonous gases in the urine. All those will go out of the body at the lower level of the body, liver and intestine. In this way, transregulation takes place. This is there in the science also. I am not a doctor. All these words are there in medical science. Not a physiology. If you study these terminology, what will happen? What is the transregulation system? What is cycling and recycling system? What happened to the urine we take into the body? All these secrets mean. It means urine that contains hundreds of chemical substances and compounds are directly transfused into blood. Transfused. You see, urine contains chemicals, many hundreds of chemicals they are heavily. What happened to these? All these chemicals? All these chemical substances, hormones, vitamins will be directly transferred, means absorbed or enters into the blood only. Directly it goes to the blood, no process at all. Because the urine is already processed. It is a clean. That is why it is called transregulation. That transregulation system helps the patient get for treatment of cancer. A number of hormones, new substances, for example, anti-neoplastin is a hormone, is a substance isolated and extracted from urine. And this is now from this lot of allopathic medicines are made. That is urine product. So that will contribute a lot for the treatment of cancer. Now going on from urine only, the extracted substances and manufactured medicines that is anti-neoplastin. So the number of medicines are made. These are all useful. Doctors knows well, but these secrets are not coming out and leaked out. It requires a lot of study, research, interpretation, and urine therapy point of view to represent to the audience. This is a very difficult task. You see, another component that will cure cancer is urea, urine urea. Urine urea is an anti-cancer substance. We know that there are so many chemical substances in urine, 200, 300 substances are there. And it also consists among them urea and uric acid. Urea, the amount of urea is 2.5. That urea is a poisonous product. That product cures virus, bacteria, and parasites. This urine component or this urea component of the urine is a substance. This is a colorless substance. A substance contains nitrogen. A substance that contains protein decomposition. This we can find in intestines, where protein decomposes is converted into ammonia. So that is an anti-cancer substitute that we can also use. And creatine hydrate. Creatine hydrate is also a component of medicine that is useful for cancer, and people are being treated with this component in other countries. Similarly, anti-neoplastin also useful. Similarly, 20 years research has been taken up by a doctor and researcher in other countries and to produce an injection. That injection also now wonderfully works for treatment of cancer, and the cost of this injection, human urine derived injection, this cost $8,000. For full treatment, it costs $2 lakhs. Many research studies are also conducted, wherein it is proved those who are taking urine therapy and their lifespan has been, or they survived a long period, lifespan has been increased comparing to the allopathic medicine those who have taken, and their life lifespan has been decreased, shortened. And in another study, research of doctors and scientists, a doctor whose parents were also suffered from cancer, and the parents also conducted research. The result, we know what are the results. The doctor did not go for biopsy test, and he did not use the allopathic medicine, but he treated his parents suffering from cancer. The evidences are all there for all these things. I'm not giving just stories for it. It is safe. And other cases, I will tell you, doctors advises the patient to come to the hospital with urine collecting at home. That bottles doctor collects and he adds some color and some taste changes, and in a new bottle, the same urine is given to the patient. Cancer and AIDS patient and various other incurable diseases. Hundreds of cases he has cured by this technique. But patient do not know whether it is urine or a medicine. Patient think that he has taken for testing. But same urine is returned, some change of color and taste. That is also there. We are all aware of water of life. A doctor, he cured hundreds of the cases with all these things. And in the urine of a pregnant woman, that is called amniotic fluid. From that, in that fluid, there is a stem cells. That stem cells have the power, capacity for the treatment of the cancer. These stem cells will produce the new cells, rebuild whatever the cells lost, tissues lost or damaged by virus. Pregnant woman urine during 9 months, in the uterus, in the womb of mother, will contain stem cells. That stem cell is out of demand today. It cures, repairs, regenerate, rebuild the cells damaged. That's the main problem today, how to build these cells. That stem cell therapy is now most popular. A lot of research work is going on this stem cell therapy. Human urine derived injections. You may wonder if you say one case, a chairman and a managing director of a pharmaceutical company in Japan, he has conducted research in his laboratory, and the findings of that research, he has written a letter to the Morarji Desai, the then Prime Minister of India. He said, the substance in the urine is isolated and extracted. This will contribute for the treatment of the cancer and the AIDS. It is there in the medical textbooks. He has written that letter to Morarji Desai because perhaps that managing director might be knowing Morarji Desai and he is using therapy practice. He has written that letter to the Morarji. So that component or the substance, if we extract it from the urine, use it and inject the cancer patient, it inhibits, kills all bacteria, all viruses. What we need for cancer treatment is killing bacteria, refilling the immunity system, and rebuild, regenerate new cells, repair the cells. There is no physical medicine. Our treatment is on the cells and the immunity system and the virus. Trillions and trillions of cells are there in cancer. Trillions, not millions and billions, trillions. That's why cancer is called a queen of terror killer, a silent killer. Very dangerous, a terrible disease is cancer. It is a social stigma on the part of the person who has cancer. And some people who disclose also that he has the cancer. That stigma, bad stigma, is stamped on the body of the person who has that cancer. So in this way, a lot of research is going on. And another important aspect, and I will complete it in 2-3 minutes. The major problem with cancer is treatment of cancer is one dimension. Another dimension is treatment of side effects. Please remember, side effect is the most dangerous cause for the patient. Cancer anyway, it will be there, we cannot cure that patient, will die in a short period of time. But side effect, the patient has to face a lot of physical troubles and strain and pain severely. There are a number of side effects. All these side effects are the outcome of the cancer patient. So the allopathic doctor has to treat, not only cure, not only this cancer, but side effects. What are the side effects? And what are the treatment for that? The treatment also again, painkiller, antibiotics. You take all the many antibiotics and painkillers, the body will spine, the body will become weak. Why? Because means cancer has side effects, after effects, ill effect, reaction, and post-operation reactions. Overdose, excess use of medicine, over-prescription, indiscriminate consumption of tablets. The number of side effects. So the problem is treatment of side effects. Not the treatment of cancer, side effects. The patient suffers every day, every hour, even without sleep. The physical troubles, physical pain, and the severity. It is here, urine therapy come into rescue for treatment of these side effects of disease. Because patient will die a painful death. Cancer is a very terrible, fearful, with painful death. Those who take urine therapy, you die without pain. But those who take and depend only on allopathic medical medicine, the painful death, unimaginable, intolerable. So, urine therapy will contribute for solving of all these side effects of pain, trouble, and severity, vomiting, sweating, pains, diarrhea. See, type of problem. Skin reactions, skin eruptions, skin itching, colorful spots, marks are formed on the skin. The body is very terrible, fearful. You cannot see the body of the cancer patient because of colorful spots will grow on the skin. So at the same time, remember, what is another dangerous disease, urine tract infections. Most dangerous. Urine stops and breaks, all urine tract disorders. Body weight is reduced, hair falls, face will become pale. No normal living, no normal good health, no good health, no normal living. Disease, decay, figure change, and physical immortality. Gradually, progressively, the body condition leads to collapse because of these side effects. For all these so many side effects, we have to take again painkillers or antibiotics or some other operations. Doctor's intervention operations.
Excuse me, Rayudu. Now the time is 9:30. Would you require some more time?
Within 2 minutes.
No. Now the time is 9:30. Will you continue for some more minutes or?
No, only just a few minutes, last few minutes.
Okay. Thank you. Continue, please.
So that is the side effects and solving the problem of side effects of the urine therapy. This also we must look after only not solving the cancer patient. Another time, bad smell. Body will become weak. Body will become skeleton, and the taste, change in the taste glands will damage, and there is a change and damage of appetites and aversion towards the food, shooting pain in the body, and above all, psychological fear, tensions, and then anxiety, depression, frustration, because psychological feeling that you will die soon. These are major problems for which there is no medicine. With all these complications, the patient ultimately will die. So in the light of all these facts and others, some of them you might be knowing, with all these things, we can attend to the cancer patient part treatment. So if there are any mistakes, please rectify and add some more knowledge to this, and advise the patients. Thank you very much.
Time for vote of thanks. I invite PC Tiwari ji to present the vote of thanks to Rayudu ji, who has given an excellent speech today, and he may announce his next topic next month. That also you may please announce, Rayudu ji. Next month is
Topic
Yeah.
is urinopathy a science or profession?
okay. Ignopathy.
Is urinopathy a science or profession?
Okay, thank you. That you can message later.
Okay.
Tiwari ji, kindly present the vote of thanks. I invite Tiwari ji.
Yes, sir. Yes, sir. Good evening, sir. Thank you
Yeah,
for inviting me for vote of thanks. I, PC Tiwari, on behalf of UU Group, I give my thanks to Rayudu Chowlamji, who has delivered a very nice presentation on the cure of cancer by the use of Shivambu therapy. I also thanks all the participants here in this webinar. I also thanks to Sri Balasubramaniam ji, Rajaram ji, who has hosted this program very well, and especially Dr. Purvi ji. Thank you, Dr. Rayudu ji, again for delivering such a beautiful presentation, and I hope the next presentation on the uridology will be very helpful for the participants. Thank you.
Yeah. Thanks to all. Rayudu ji, thank you. Tiwari ji, thank you. Rajaram ji, thank you. Arjun ji, Parameshwaran Doctor, Gandhi ji, Jeevan ji, and Nor, Sanjeevan and Sriraj, all Purvi ji. Thanks to all. Thank you.
Yeah, thank you, sir.
Rayudu ji, thanks a lot.
Thank you,
Meet
sir.
the next one.
Take rest. Yeah, thank you.
Yeah, good night, sir.
Yeah, good night.
Thank you.
Good night to all.
Good night, everyone.
Good night.